Because for a meaningful number of seniors, the nerve damage isn't coming from age, and it's not coming from the diabetes. It's coming from something sitting in the medicine cabinet right now, something that's depleting the one nutrient nerve myelin can't survive without, or something that was given to fix the problem and is quietly creating the next one. And the difference between knowing which one you have and not knowing could be the difference between recovery and permanent damage. Beverly was 74 years old, and she had done everything right. Her blood sugar was controlled. Her A1C, that 3-month average blood sugar score, was 6.8. Her diabetes doctor was proud of that number. But her neuropathy had started anyway, 4 years ago. And every year, it got worse. More burning at night, more numbness in her feet. Her ankles started swelling. Her cardiologist ordered a heart scan because the swelling looked like early heart failure. Beverly's daughter sat down with a pharmacist and brought Beverly's full medication list. What that pharmacist found in 12 minutes had never been found in 4 years of doctor visits. I'll tell you what she found and what changed before this video ends. The people who never hear what I'm about to tell, you keep doing the exercises and wondering why nothing is working. The ones who do hear it ask one question at their next pharmacy visit, and for the first time in years, the picture starts to change. Think of the coating on an electrical wire. That coating keeps the signal clean and moving fast. Your nerve fibers have the same kind of coating. It's called the myelin sheath. When that coating breaks down, the signal misfires. You feel burning, tingling, numbness. That misfiring is neuropathy. That coating is built from B12, not in a general way, specifically. Your body can't build or repair myelin without it. If your B12 supply is being quietly cut off, your nerves can't fix themselves, no matter how many exercises you do, no matter how well your blood sugar is controlled. Here's the part most doctors miss. Metformin, the most common diabetes pill prescribed in the country, blocks the part of your gut that absorbs B12. It does this through a process in your small intestine. It has been doing this since the day you started taking it. A study published in the BMJ followed over 300 adults on metformin for more than 4 years. Those taking metformin had a 19% drop in B12 levels compared to those who weren't. About 1 in 14 long-term users developed a true deficiency. Now add a stomach acid pill, a PPI, like omeprazole or pantoprazole. These are among the most prescribed medications in seniors. They work by reducing stomach acid. But your body needs stomach acid to release B12 from food. So the stomach acid pill cuts off B12 from the top. The metformin cuts it off from the bottom. If you are on both, you have 2 separate blockades running at the same time. Neither may have ever been flagged. There's also a problem with the test. A standard B12 blood test can show a number that looks acceptable, above the cutoff your lab uses, while your cells are still starving for it. A more accurate marker is something called methylmalonic acid, a waste product that builds up in your blood when your cells can't use B12 properly. Researchers published in the Journal of Diabetes Research confirmed patients can have a borderline normal B12 reading and significantly elevated methylmalonic acid at the same time. The serum number looked fine. The cells weren't fine. If your doctor said your B12 is normal, the follow-up question is, was methylmalonic acid also checked? Now let me walk through the specific medications linked to nerve damage and tell you exactly what to do if any of these apply to you. First up, the one already mentioned, metformin and what it's doing to your B12. The BMJ study I mentioned followed 390 adults over 4.3 years. Those taking metformin had a 19% lower B12 level. About 1 in 14 developed deficiency. Two-step framing matters here. Metformin depletes B12. B12 deficiency causes nerve damage. If your neuropathy started or worsened after starting metformin, and your B12 has never been checked, that's the conversation to have this week. There's another common one that does the same thing from a different angle, stomach acid pills. These medications reduce stomach acid. Your stomach needs acid to free B12 from food. The depletion is slower than with metformin, but it's real and it compounds over years. If you take both a stomach acid pill and metformin, ask your pharmacist directly, am I running 2 separate B12 depletion pathways at once? What about statins? There may be a connection here too, though the evidence isn't as clear-cut. This one requires careful framing because the evidence isn't settled. A case control study published in the journal Neurology in 2002 looked at over 4,500 adults. It found that people on statins had notably higher rates of a nerve condition with no other identified cause, particularly among long-term users. However, a separate U.S. study found no significant connection. The FDA hasn't added a neuropathy warning to statin labels, so this is an established fact. But if your neuropathy appeared or got noticeably worse after starting a statin, and no other cause has been found, that timing is worth discussing with your doctor. Switching from certain statins to others has helped some patients. Then there's gabapentin, and this one's a bit of a trap. Gabapentin is one of the most commonly prescribed neuropathy medications for seniors. It's also listed in its own prescribing information as a cause of ankle and leg swelling. That swelling can look exactly like early heart failure or poor circulation. Seniors are sometimes sent for cardiac workups, echocardiograms, diuretics added, when the real cause is the neuropathy drug itself. The prescribing information confirms this happens more often in older patients. If you're on gabapentin and your ankles have swollen, tell your doctor. Don't stop the medication on your own, but don't let the swelling go uninvestigated either. If you take colchicine for gout, there's something else worth knowing. Colchicine is commonly prescribed for gout. Its own label states it can cause nerve and muscle damage with long-term use. And the risk is higher in people with kidney problems, which is common in seniors. If you take colchicine for gout and have developed new weakness or sensory changes, ask your doctor whether the medication could be involved. Nitrofurantoin is next, a common antibiotic for UTIs and one with its own warning. This is one of the most commonly prescribed antibiotics for urinary tract infections in older women. Its FDA label includes this warning in plain language: peripheral neuropathy, nerve damage, which may become severe or irreversible, has occurred. The label specifically names diabetes, kidney problems, and low B vitamin levels as risk factors. Those conditions are extremely common in seniors over 70. If you have taken nitrofurantoin repeatedly for UTIs and developed new tingling, numbness, or weakness in your hands or feet, tell your doctor immediately. For blood pressure, there's also hydralazine to consider. Hydralazine is prescribed for high blood pressure and heart failure, often in patients who can't take other blood pressure drugs. Its FDA label states it can deplete vitamin B6, a different B vitamin from B12, through a completely different process. B6 deficiency causes nerve damage on its own. If you take hydralazine and develop tingling or numbness, ask your doctor to check your B6 level. And if an irregular heartbeat brought you to amiodarone, listen closely here too. Amiodarone is one of the most commonly prescribed medications for atrial fibrillation, an irregular heartbeat that affects roughly 1 in 10 adults over 75. Its label states, long-term use may lead to nerve damage that may not resolve even when the medication is stopped. That's the FDA's own language. If you take amiodarone and develop new numbness or weakness, tell your doctor right away. Early recognition matters here, because stopping the drug later may not reverse the damage. Whichever of these medications is on your list, grab a pen. Here's the specific question to bring to your pharmacist, not your primary care doctor first, your pharmacist. Say this: can you review my full medication list for any drugs linked to B12 depletion, B6 depletion, or peripheral nerve damage? And tell me whether my neuropathy timeline matches any medication change? That review costs nothing. It takes one appointment. It's exactly what changed Beverly's outcome. If your pharmacist identifies a concern, bring it to your prescribing physician with this. I'd like to check my B12 level and my methylmalonic acid level, not just the standard B12 test. Those are the two specific words, methylmalonic acid. Write them down. Don't stop any medication on your own. Every change described in this video, switching a stomach acid pill, tapering gabapentin, adjusting a statin, was done under physician supervision. The goal of this video is to give you the question, not to give you the answer your doctor needs to provide. And now the one I said might not reverse. because you deserve the honest answer before you spend another year doing exercises for something that requires a different conversation. Ciprofloxacin, levofloxacin. These are fluoroquinolone antibiotics, commonly prescribed for UTIs, ear infections, and respiratory infections. In 2013, the FDA issued the strongest warning it can place on a drug, a black box warning, specifically for peripheral nerve damage. The warning states the damage can begin during the course of antibiotics or show up weeks after you finish them. And for some people, it doesn't go away. Most seniors never connect the antibiotic to the neuropathy. The antibiotic finished weeks ago. The nerve damage appeared later. Nobody asked about the timing. If you took a course of ciprofloxacin or levofloxacin in the months before your neuropathy began, or before it got suddenly and noticeably worse, that timing is a conversation you need to have with your doctor this week, not next month, this week. Early recognition is the only intervention available. There's no proven reversal treatment once the damage is established. I want to be clear. Fluoroquinolone neuropathy doesn't resolve for everyone. Partial recovery happens. Full recovery happens for some, but some people don't recover. That's the honest answer, and you deserve it. So, what happened to Beverly? The pharmacist ran 2 blood tests. Beverly's standard B12 number looked borderline, technically above the cutoff, but in the gray zone. Her methylmalonic acid level was significantly elevated. Her cells were functionally starving for B12, even though the standard number had looked acceptable for years. Metformin and the stomach acid pill had been running 2 separate depletion pathways the entire time. Neither had ever been flagged. The ankle swelling had nothing to do with her heart. The echocardiogram came back completely normal. Her cardiologist had been chasing a side effect of the gabapentin. Monthly B12 injections were started. The stomach acid pill was switched to a different medication. The gabapentin was tapered over 6 weeks under her doctor's supervision. At 12 weeks, Beverly told her daughter, "The burning at night was meaningfully reduced for the first time in 4 years. Not gone. Nerve healing takes months, and hers had gone unaddressed for a long time. But for the first time, she was moving in the right direction." Her diabetes doctor had spent 4 years adjusting her blood sugar. The cause had been in the medicine cabinet the entire time. What I want to be clear about, B12 deficiency neuropathy is very often reversible when identified early. Once B12 is restored, the myelin coating on your nerve fibers can begin to rebuild. That process takes months, not days. The sooner it starts, the better the recovery. But it does recover. Disclaimer, this is general health information, not advice for your specific situation. For your own case, speak with the physician who knows your full history. But now you know the difference between neuropathy that keeps progressing because nothing has addressed the cause, and neuropathy that keeps progressing because the cause is still active in your medicine cabinet. You walked into this video frustrated that the exercises weren't working. You're walking out knowing exactly what to ask your pharmacist, exactly which 2 tests to request, and the specific conversation about a fluoroquinolone antibiotic you need to have with your doctor if the timing fits. If someone you love has neuropathy and they take metformin, a stomach acid pill, or a statin, or if they took a course of antibiotics in the months before their neuropathy started, share this before their next appointment. The B12 test that changed everything for Beverly costs less than $10. The conversation that ordered it took 12 minutes.